If you're over 60 and you've been waking up with heavy aching legs, or you've noticed those twisted bulging veins getting worse despite doing everything your doctor recommended, there's something you absolutely need to know. What you do during those 8 hours of sleep could be silently sabotaging your vein health, and most people have no idea they're making these mistakes every single night. In fact, I've seen patients in my clinic who were doing everything perfectly during the day, following every recommendation to the letter, yet their varicose veins kept progressing, kept causing more pain, more swelling, more frustration. And when we finally discovered what was happening during their sleep hours, everything changed. You see, varicose veins affect nearly a quarter of all adults, and the numbers get higher as we age. By the time you reach your 60s and 70s, those bulging, twisted veins become increasingly common and increasingly problematic. But here's what most people don't realize. The progression of varicose veins isn't just about genetics or how much you stand during the day. Your nighttime habits play a crucial role in whether your veins get better, stay the same, or get worse. And the mistakes I'm about to share with you are so common, so seemingly innocent, that you might be making several of them right now without having any idea. I'm Dr. Emily Hartwell, and I've spent over 20 years as a vascular specialist treating patients with venous disorders. I completed my fellowship in vascular medicine at one of the nation's leading medical centers, and since then, I've performed thousands of vein procedures and consultations. Over the years, I've seen patterns emerge that most people never think about, patterns that can make the difference between managing your varicose veins successfully and watching them progressively worsen despite your best efforts. What I'm about to share with you comes directly from my clinical experience, from seeing thousands of patients walk through my doors wondering why their varicose veins keep getting worse despite their best efforts during the day. These are the hidden saboteurs of vein health, and they're happening while you're completely unconscious. Before we dive into these critical nighttime mistakes, if you haven't subscribed to this channel yet, I highly recommend you hit that subscribe button and tap the notification bell so you never miss another health tip designed specifically for you. And if you find this video helpful, please leave your questions and video suggestions in the comments below. I read every single one, and your feedback helps me create more content to help people just like you. Now, let me tell you about Mrs. Dorothy Henderson. She's a 73-year-old retired school teacher from Portland, Oregon, who came to see me absolutely frustrated. Dorothy had spent 35 years on her feet teaching fourth graders, and she'd developed varicose veins in her late 50s. She'd been dealing with them for over 15 years, and she was doing everything right during the day. She wore her compression stockings religiously, even though she admitted they weren't the most comfortable. She walked every morning with her husband Frank around their neighborhood. She elevated her legs when she watched television in the afternoon. She drank plenty of water and maintained a healthy weight. But her veins kept getting worse. The rope-like vessels on her calves had become more prominent over the past 2 years. Her legs would throb so badly at night that she'd wake up 3 or 4 times, disturbing not just her sleep, but her husband's as well. And by morning, her ankles looked like they belonged to someone else, swollen and discolored with a brownish tint that worried her terribly. When I started asking her about her nighttime routine, I discovered she was making not 1, not 2, but 5 of the 7 mistakes I'm going to share with you today. And Dorothy isn't alone. In my practice, I've found that the vast majority of my patients are unknowingly sabotaging their vein health while they sleep, during the exact time when their body should be healing and recovering. Let me explain why nighttime matters so much for your veins, because understanding this will help everything else make sense. When you're lying down, your circulatory system has a unique opportunity. Gravity isn't working against your veins the way it does when you're standing or sitting. During the day, your veins have to push blood upward against gravity, from your feet all the way back to your heart. That's a lot of work for veins that are already weakened. But at night, when you're horizontal, this should be prime recovery time for those tired vessels in your legs. Your body naturally goes into repair mode during sleep, and this includes your blood vessels. During the deeper stages of sleep, your body releases growth hormone, and increases blood flow to tissues that need repair. Your vein walls, which have been stretched and stressed all day long from bearing the weight of the blood column above them, have a chance to recover. Inflammation that accumulated during the day can be resolved. Microscopic damage to the vein walls can be repaired. This is why sleep is so critical for vascular health. However, if you're making certain mistakes, you're not just missing out on this recovery period. You're actually making things worse. You're turning what should be healing time into damage time. And this is why some people see their varicose veins progress despite doing everything else right during their waking hours. The first critical mistake I see is sleeping completely flat without any leg elevation. Now, I know what you might be thinking. Dr. Hartwell, I'm already lying down, isn't that enough? Unfortunately, no, it isn't. When you sleep on a completely flat surface, your legs are at the same level as your heart. This is better than standing, certainly, but it's not optimal for venous return, especially when you have compromised vein function. I had a patient named Mr. Robert Chen, a 68-year-old former restaurant owner from San Francisco. Robert had owned and operated a popular dim sum restaurant for over 40 years before retiring. That meant decades of being on his feet for 12 to 14 hours a day. He came to me with severe venous insufficiency in both legs. His calves would cramp so badly at night that his wife Margaret had to help him out of bed, massaging his legs until the spasms passed. When I asked about his sleeping position, he told me he'd slept on a perfectly flat mattress his entire adult life. What happens when your legs are flat is that the blood in your leg veins has to work against neutral pressure to return to your heart. The valves in your veins, those tiny one-way doors that keep blood flowing upward, are already weakened when you have varicose veins. These valves are supposed to snap shut after each heartbeat, preventing blood from flowing backward. But when they're damaged, they don't close properly. Without even a slight elevation, you're not giving them any help during those crucial recovery hours. Think of it this way. During the day when you're standing or sitting, your vein valves are working overtime, constantly closing against the downward pull of gravity. By the end of the day, they're exhausted and slightly swollen from all that work. At night, with your legs elevated even slightly, you're giving those valves a true rest. The blood flows more easily back to your heart, and the valves don't have to work at all. But if your legs are flat, the valves are still in a state of partial work, never getting that complete rest they need to recover. The solution isn't complicated or expensive. Elevating your legs just 4 to 6 inches above heart level while you sleep can make a remarkable difference. You can use a wedge pillow designed for this purpose, or simply place a firm pillow under your mattress at the foot of the bed. Robert started doing this, and within 3 weeks, his nighttime cramping had reduced by about 70%. He went from waking up 5 or 6 times a night to maybe once. His wife told me it was like getting her husband back. If you're still watching and finding this information valuable, do me a favor and drop a comment below just saying you're here. It helps me know this content is reaching people who need it, and it helps this video reach others who might be suffering silently with the same problems. The second mistake is one that might surprise you. Sleeping in a room that's too warm. I see this constantly, especially with my patients who live in colder climates. They crank up the heat at night, pile on the blankets, and create what they think is a cozy, comfortable sleeping environment. But for your veins, it's actually a hostile environment that promotes vein dilation and impairs proper circulation. Mrs. Patricia Sullivan, a 71-year-old grandmother from Chicago, was a perfect example of this. Patricia loved her warm bedroom because she'd always been sensitive to cold. She kept her thermostat at 74 degrees at night and slept under a heavy down comforter. She wore flannel pajamas and thick socks. Her varicose veins had progressed significantly over just 2 years, faster than I would have expected given her other habits, which were actually quite good. Here's what happens in a warm environment. Heat causes your blood vessels to dilate, to expand in diameter. This is actually a cooling mechanism. Your body is trying to bring more blood to the surface of your skin, where the heat can escape into the surrounding air. For healthy veins with intact walls and properly functioning valves, this dilation isn't a problem. The veins expand, do their job of cooling the body, and then return to their normal size when the temperature normalizes. But for varicose veins with already weakened walls and faulty valves, dilation makes everything worse. The vein walls stretch even more, becoming increasingly distorted. The valves, which are already struggling to close properly because the vein has lost its normal shape, become even less effective at preventing backflow. Blood pools in your legs instead of returning efficiently to your heart. And when this happens night after night for months or even years, the cumulative damage is substantial. I should also mention that warm sleeping environments tend to cause more restlessness. You toss and turn more, which means your legs are more likely to end up in positions that aren't optimal for venous return. So there's a double problem happening. The ideal sleeping temperature for vein health is between 65 and 68 degrees Fahrenheit. Patricia was skeptical when I suggested she lower her thermostat and switch to lighter bedding, but she agreed to try it for 1 month. When she came back, the swelling in her ankles had decreased noticeably, and she reported that her legs felt significantly lighter in the mornings. She told me her grandchildren had commented that she seemed to have more energy. The third mistake I need to warn you about is wearing restrictive clothing to bed. This includes tight socks, tight pajama bottoms with elastic bands, anything that presses into your skin around your calves, thighs, or waist. I've had patients who wear their daytime compression stockings to bed, thinking they're being extra diligent. This is actually counterproductive in most cases. Mr. William Torres, a 65-year-old retired postal worker from Phoenix, Arizona, was wearing knee-high compression socks 24 hours a day, 7 days a week. William had walked a mail route for over 30 years, and his legs had paid the price. He figured if wearing compression during the day was helpful, wearing them at night would be twice as helpful. What was actually happening was that the socks were creating a tourniquet effect at his knees while he slept. During the day, when he was upright and moving, the compression worked with gravity and muscle contraction to push blood upward. But at night, when he was horizontal and his muscles were relaxed, the tight band at the top of the sock was impeding circulation rather than helping it. When he woke up, his feet were often cold and tingly. Unless your doctor has specifically prescribed nighttime compression for severe lymphedema or other specific conditions, you should let your legs breathe at night. Wear loose, comfortable sleepwear that doesn't constrict anywhere. William was actually relieved when I told him to take off the socks at night. Within a few weeks, the tingling in his feet had resolved completely, and his morning leg swelling had improved. Now let me share the fourth mistake, and this one is particularly important for those of you who enjoy an evening drink. Consuming alcohol too close to bedtime is terrible for varicose veins, and the timing makes all the difference. Many of my patients enjoy a glass of wine with dinner or a cocktail in the evening, and I'm not here to tell you that you can never have a drink. But alcohol within 3 hours of bedtime can significantly worsen your vein symptoms. Mrs. Eleanor Martinez, a 70-year-old retired accountant from Denver, came to me complaining that her legs had become unbearably restless at night. She would lie down, and within an hour, her legs felt like they had a mind of their own, twitching and aching. She also noticed that her varicose veins seemed more prominent and painful in the mornings. When I took her history, I learned that Eleanor had developed a habit of having 2 glasses of red wine each evening while watching her favorite shows before bed. She'd read that red wine was good for circulation because of the antioxidants, so she thought she was helping herself. Here's what alcohol actually does to your veins, and there are multiple mechanisms at work here that most people don't understand. First, alcohol causes vasodilation, similar to heat, which puts additional stress on already weakened vein walls. Your veins expand, and for varicose veins that are already stretched beyond their normal capacity, this additional expansion just makes things worse. Second, alcohol acts as a diuretic, which means it makes you urinate more frequently. This can lead to dehydration, especially overnight when you're not drinking water to replace what you're losing. Dehydration thickens your blood, making it more viscous and harder to circulate efficiently. Thick, sluggish blood moves more slowly through your veins, promoting pooling and stagnation in the already compromised vessels of your legs. Third, Alcohol interferes with the quality of your sleep, reducing the time you spend in deep restorative stages when your body does most of its healing and repair work. You might fall asleep faster after a drink, but the architecture of your sleep is disrupted. You spend less time in the deep sleep stages where tissue repair happens, and your veins don't get the recovery time they need. Fourth, and this is something many people don't consider, alcohol can worsen restless leg syndrome, which is already more common in people with venous insufficiency. The combination can create a vicious cycle of poor sleep and worsening vein symptoms. I asked Eleanor to either eliminate the evening wine or move it to earlier in the day, having it with lunch instead of dinner. Within 2 weeks, her restless legs had calmed considerably, and over the following months, her morning symptoms improved significantly. If you've been following along and recognizing any of these patterns in your own life, I want you to know that you're not alone, and more importantly, these are all things you can change starting tonight. The fifth mistake seems completely unrelated to veins until you understand the anatomical connection: sleeping on your stomach or in positions that compress your abdomen. Mr. James Patterson, a 69-year-old former construction supervisor from Atlanta, had been a stomach sleeper his entire life. He couldn't imagine sleeping any other way. But James had developed severe varicose veins in both legs, along with chronic pelvic congestion that no one had connected to his vein problems. His legs ached constantly, and he'd developed skin changes around his ankles. When you sleep on your stomach, you compress the veins in your pelvis and abdomen. This increases pressure in the veins of your legs and makes it harder for blood to return to your heart. The weight of your body pressing down on your abdomen creates back pressure in the entire venous system below that point. It's like stepping on a garden hose. The water can still flow, but with much more difficulty. For someone with healthy veins, this compression might not cause noticeable problems. Their valve function is intact, their vein walls are strong, and they can handle some extra pressure without consequence. But for someone with varicose veins, this added pressure night after night can accelerate the progression of venous disease significantly. Every night spent on your stomach is adding to the cumulative damage. There's also the issue of how stomach sleeping affects your breathing and oxygen levels during the night. Some stomach sleepers breathe less efficiently in that position, which can affect oxygen delivery to tissues throughout your body, including the walls of your veins. Optimal oxygenation is important for tissue repair during sleep. The ideal sleeping position for vein health is on your back with your legs slightly elevated, or on your side with a pillow between your knees. Side sleeping, particularly on your left side, can actually improve venous return because it takes pressure off the inferior vena cava, the large vein that returns blood from your lower body to your heart. James struggled with changing his sleep position at first. He'd been a stomach sleeper for nearly 70 years, but he used body pillows to help keep himself from rolling onto his stomach, and gradually, over about 6 weeks, he adapted to side sleeping. The improvement in his leg symptoms was substantial enough that he told me he wished someone had mentioned this decades ago. Mistake number 6 involves something many of you probably do every night without thinking twice about it: keeping your legs crossed or curled up tightly while you sleep. We can't completely control our positions while we're unconscious, but many people start the night in positions that compromise their circulation and then stay that way for hours. Mrs. Barbara Johnson, a 74-year-old former nurse from Seattle, always curled up in what she called her cozy ball when she went to sleep. She'd pull her knees up toward her chest and wrap her arms around her legs. She'd slept this way since childhood, and it was the only way she felt comfortable falling asleep. Barbara came to me with significant venous insufficiency and had developed venous ulcers on her lower legs that weren't healing well. When I asked about her sleeping position, I immediately understood part of the problem. When you curl up tightly, you're bending your legs at sharp angles that compress the veins behind your knees and in your groin area. These are critical junction points for venous return. The popliteal vein behind your knee and the femoral vein in your groin are major highways for blood returning from your legs to your heart. Compressing them for hours every night creates a roadblock for blood trying to get back to your heart. When these major veins are kinked or compressed, The blood backs up into the smaller veins downstream. Pressure increases in the lower leg veins, the very vessels that are already struggling with valve dysfunction and weakened walls. And the damage accelerates because those vulnerable veins are now dealing with even more pressure than they would face normally. I've had patients tell me they sleep in the fetal position because it feels comforting or secure. I understand that emotional connection to a sleeping position. But when you're dealing with venous disease, that comfort position might be contributing to your worsening symptoms. The good news is that you can often find a modified position that provides similar psychological comfort without the venous compression. I worked with Barbara on gradually modifying her sleeping position. She started by using a body pillow to hug instead of her own legs, which gave her a similar sense of security without the venous compression. Barbara reported that her legs felt noticeably less heavy in the mornings, and more importantly, her venous ulcers finally started to heal properly. But perhaps the most overlooked mistake, and this is mistake number 7, is inconsistent sleep timing. Going to bed and waking up at wildly different times disrupts your body's circadian rhythm, and this has direct effects on vascular health that most people never consider. Mr. George Williams, a 67-year-old semi-retired consultant from Boston, was a perfect example of this problem. George kept irregular hours because he still took occasional consulting jobs and often worked late. Some nights he'd go to bed at 10, other nights at 2 in the morning. His wake times varied just as much. George's varicose veins had become increasingly symptomatic over the past 3 years, with worsening heaviness, achiness, and night cramps. He assumed it was just part of getting older. Your body's circadian rhythm influences almost every physiological process, including how your cardiovascular system functions. Vein wall repair happens during specific phases of sleep, particularly during the deeper slow-wave sleep stages. Inflammation regulation follows circadian patterns, with your body naturally ramping up anti-inflammatory processes during the night. Blood pressure fluctuates in a predictable pattern throughout the 24-hour cycle, with a natural dip during nighttime sleep that's important for vascular health. When you disrupt your sleep schedule by going to bed and waking up at inconsistent times, you disrupt all of these carefully orchestrated processes. Your body doesn't know when to initiate repair mechanisms because the timing signals are confused. The anti-inflammatory processes don't activate properly because your internal clock is out of sync. The normal blood pressure dip may not happen, or may happen at the wrong time. Studies have shown that people with irregular sleep patterns have significantly higher rates of cardiovascular problems, including hypertension, heart disease, and yes, venous disease. Shift workers are particularly vulnerable to these effects. Your veins need consistent timing cues to function optimally and to repair damage accumulated during the day. I recommended that George establish a consistent sleep schedule, going to bed and waking up at the same times every day. It took about 3 weeks for his body to adjust, but once it did, George noticed that his nighttime symptoms had improved significantly. His legs weren't cramping as often, and the morning heaviness had decreased. Now, I want to talk about what happens when all these mistakes combine. Most of my patients aren't making just one of these errors. They're making several simultaneously, and the effects compound. Remember Mrs. Dorothy Henderson? She was sleeping flat in a warm room, wearing tight socks, and had irregular bedtimes. When we addressed all of these issues together, the improvement in her symptoms was dramatic. Within 2 months, she told me her legs felt better than they had in 10 years. The swelling had reduced, the throbbing had diminished, and she was finally sleeping through the night. I also want to address something important. These nighttime modifications are not a substitute for medical treatment. If you have significant varicose veins, you should be under the care of a vascular specialist who can evaluate whether you need procedures like sclerotherapy, ablation, or other interventions. What I'm sharing today is meant to complement medical treatment, not replace it. But patients who make these nighttime changes alongside their medical treatment consistently do better than those who don't. Their symptoms improve more, their treatment results last longer, and their overall quality of life is better. So let me summarize what we've covered today. First, Sleeping completely flat without leg elevation. Consider elevating your legs 4 to 6 inches. Second, sleeping in a room that's too warm. Keep your bedroom between 65 and 68 degrees. Third, wearing restrictive clothing to bed. Unless specifically prescribed, let your legs breathe at night. Fourth, consuming alcohol too close to bedtime. Have your drink at least 3 hours before bed. Fifth, sleeping on your stomach or in positions that compress your abdomen. Try sleeping on your back with elevated legs or on your side. Sixth, sleeping with your legs crossed or curled up tightly. Avoid positions that compress the veins behind your knees and in your groin. And seventh, irregular sleep timing. Try to go to bed and wake up at the same time every day. I know change isn't easy, especially when it comes to sleep habits we've had for decades. But your veins have been working hard for you your entire life. They deserve a little extra care during those nighttime hours when the rest of your body is resting and recovering. I encourage you to pick 1 or 2 of these changes to start with tonight. Don't try to overhaul everything at once. Small, consistent changes add up to big improvements over time. And please, talk to your own doctor about your specific situation. If you found this information helpful, I'd love to hear from you in the comments. Let me know which of these mistakes surprised you the most, or share your own experiences with managing varicose veins. Your stories help others who might be going through the same thing. Thank you for spending this time with me today. Your health matters, and I'm honored that you trust me to be part of your wellness journey. Take care of yourselves, take care of those precious veins, and I will see you in the next video.